Hi everyone, I am S. Prakash, Assistant Professor, Department of Commerce, Dr. SNS Rajaration College of Arts and Science. My design thinking video is drug awareness program. My students given to that, solution to that. How about influence to the drugs in students' circle? So I hand over the session to my students now. Thank you.
We are going to discuss about the distribution of drugs using design thinking process.
Now we are going to see about an empathize, understanding the problem of a ground level. The first stage involves deeply understanding the people affected by the poor drug distribution, patients, paramedics, logistics providers and health administrators. Key observations and insights. Patterns in rural and remote areas struggle to receive life-saving drugs on time. Paramedics report inconsistent stock levels and delayed replenishment. Logistic personnel face difficulties in maintaining proper temperature during the transit. Healthcare and facilities often suffer from the lack of transparency in supply tracking. Methods used: field interviews, shadowing with delivery agents, hospital visits, and survey with patients and health workers.
Define. Framing the real problem. Based on our research, we framed a clear problem statement. Patients, especially in underserved and rural areas, experience critical delays in receiving essential medicines due to fragmented supply chains, cold storage limitations, and lack of real-time tracking mechanism. This definition keeps the users, the patient, at the center of the challenge while considering logistics and system constraints.
So now we have ideate. Now that we understand the problem, we move to generate as many solutions as possible without judging them too early. This is a creative and collaborative stage. A centralized digital platform for real-time inventory visibility across and warehouses. Blockchain-based drug tracking to ensure authenticity and traceability of drug during shipment. Use of AI to predict demand and prevent stockouts in high needs areas. Dozens or e-bags for last mile delivery in hard to reach villages. Partnering with local shops and clinics as distribution points. A mobile app for patients to search for medicines availability nearby and request delivers. These ideas were prioritized based on feasibility, impact and user desirability.
Prototype, building step, test versions of the solution. We selected the most promising solution, creating low cost, quick prototype to test with real users. Example for prototypes. Developed a mock-up of the patient-facing mobile app, showing medicine availability and allowing online ordering. A logistic dashboard showing real-time stock levels and delivery routes. A demo blockchain ledger to simulate drug tracking and ensure authenticity. A small-scale trial of the drone delivery in control village area. These prototypes didn't need to be perfect, just realistic enough to gather feedback.
So now we have the test. Getting real-world feedback and improving. Patients found the app easy to use and appreciated the ability to locate medicines quickly. Pharmacists and logistics team saw the benefits of real-time inventory tracking. Health officers were impressed with the transparency enabled by blockchain tracking. Drone delivery worked well in dry, flat areas but faced limitations in urban and mountainous terrain. Based on this feedback, we made improvements like adding voice support for non-tech sway users, improving the cold chain containers for temperature-sensitive drugs, integrating the system with local government health schemes for broad results.
Conclusion: a human-centered tech-enabled approach. By following the design thinking process, we are able to understanding the root causes of drug distribution failures, innovate meaningful user-focused solutions, test and refine ideas to ensure feasibility, usability and sustainability. The final vision is a smart, decentralized and transparent drug distribution network that improves access, reduces waste, and ultimately save lives.